Hello and welcome. My name is Judy and I am the host for Mothers for Mental Health Care Reform, who are advocating for change in legislation that impacts access to treatment for severe mental disorders. Today's subject will be, where did my child go? Today we are here with three moms who will be sharing their journey. Welcome, ladies. Can you share the struggles you faced when your child was first diagnosed and the ongoing trauma it has caused within the family?
Well, I can start. It's really a puzzle, and the puzzle is ever changing. My son was winning chess tournaments. He was a gifted soccer goalie. He was designated high in math scores, gifted in school, in special classes, very happy, doing really well. And he became sullen and withdrawn. There was some bad behavior at school, and we had thought that he was just bad, but actually it was the beginning of madness. Near the school, my son set a fire to a friend's notebook. Luckily, this qualified us for some counseling and got us on the wait list for a psychiatrist. Along with another friend, my son stole a car, only caught because they crashed. Very luckily, the Justice of the Peace ordered a psych assessment. But he told the doctor that he's sleeping well, and actually, he was up walking around all the night. Another time, my son burst into our front door, distraught and rambling about how the Bloods and Crips were both fighting over him. However, as we live in a wealthy upscale neighborhood, my understanding was that this is an explanation of how his gold necklace went missing. I felt my son really believed the gangs were fighting over him, but I was at a loss to make sense of it. Over time, I slowly realized that my high expectations for this gifted student were no longer realistic. As a single mom, when it became clear that my son was not attending school and sneaking around with marijuana, I followed up with some counselors who got his name on waiting lists. When an opening came up, I backed down, saying that I was afraid he might learn worse things from the other boys in a group home. At that time, it was my understanding that there was no programming for him there. I did keep brochures about other programs, and when my son was refusing to take out the garbage bag, I would wave around the page and say, I've been thinking this program might be really good at Eva's Phoenix. They find people work and you get to sleep there too. I was told that I couldn't help my son because he had to ask for help himself. And I did think that the doctors know how to fix the situation. But I became frustrated. For example, the high school guidance counselor was saying that bizarre behavior is quite common among students who are designated as gifted. No one really wants to call a person a label like Asperger's or bipolar, and I think that now was their reluctance to say that this is a serious problem. If they were stalling for time, I felt impatient. My son became very sullen, speaking very few words. He felt headaches, and his remedy was to wear hats very tightly. One day he showed me that he had dozens of pennies wrapped up inside his hat. But I didn't know what to make of this. One day I was typing a memo in my office gramophone to say that my son arrived at their house. He claimed that he had skated on rollerblades along the highway from Toronto to Hamilton. Although it could not be true, my son was not lying because he really believed that's how he went 100 miles. It was only because I followed up with my son's teacher that I learned a key point. He was attending a class about electricity and actually swallowing metal screws. Not only was I shocked, but I was frustrated that the students just laughed and did not know enough to report this behavior much sooner. There have been so many instances over the years. The key thing that's helped us is having a diagnosis of chronic paranoid schizophrenia. I felt really relieved. Now I understood that it wasn't bad parenting or mistakes. This was a serious brain disorder, and now we could move along with recovery. It sounds strange to say I felt relieved, but I knew that at least we were now on a course. All in all, from the beginning of the bad behavior to the diagnosis was 6 years. How about you guys? What did you find?
My journey with my family member and my loved one was a little different from my friend. My child was an outgoing, organized individual who made friends very easily. He was articulate, played various sports. His two favorite were soccer and hockey, and he played them until his early 20s. In soccer, he was on the provincial team. Throughout his life, he was always curious, taking things apart, putting them back together again. He was a peacekeeper, always looking for ways to resolve conflict. When this journey started, there were things he started to do and say that were not normal. He started talking about the FBI being in his phone, looking out the window, closing the curtains so no one could see in, obsessed that people were out to get him. One morning, he came down from his bedroom with blood around his mouth. When his father asked him what happened, he said he needed to take the implants out of his mouth because people were listening into his conversation. During the summer that year, he went to LA 3 times, all in a matter of 2 months. The first time he stayed at a hostel, and he had money to stay for 3 nights only, but had booked a flight for 10 days. Until he then called, after the 3 days, he called us and asked us to pay for the remaining nights. The second time he left, he rented a car and he slept in the car. Both times he had no money for food. The third time he decided to go, he booked his flight and a hotel room. And the night before he had to leave, he came back from work and said the license plates were giving him signs to go to Miami. He booked himself a flight to Florida without canceling his LA trip. As a result, he lost money from that trip. In Florida, he stayed there for 3 days and then booked a flight to go to LA. We didn't know about this. So my husband and I, after 3 or 4 days of not hearing from him, decided to give him a call on his cell phone. When we called him, we found out that he was in LA and he had been sitting in the LA airport for 3 days without food. And the reason why was because he had no money for a hotel room, no money for food, and no money to get home. Obviously, we booked him a flight home. There were a number of strange things like this that continued to occur that first year. And at the time, he was willing to try and figure out what was going on. What was happening? Why was he doing these things? And he thought they were normal. Because he was willing to investigate the reasons behind all these actions, we started by going to the family doctor. The family doctor couldn't do anything other than he recognized and acknowledged that something was going on. He referred him to a psychiatrist, but the waiting list was for a year and a half, 2 years before my son could get to see him or her. In addition, the family doctor recommended that we take him to the ER in the hopes that the psychiatrist on call would be able to see him. We went to the ER. Unfortunately, the psychiatrist that was supposed to be on call was not there. But the ER doctor recognized that something was off, and he ended up organizing an appointment with the psychiatrist for my son. The waiting period was only 2 weeks. Needless to say, we were ecstatic and happy that all we had to do was wait 2 weeks and my son would see a psychiatrist. But before we had everything finalized, a crisis worker came. The crisis worker didn't talk to us like the ER doctor did. She spent a lot of time with the doctor. She then spent about 10 minutes with my son and decided that he didn't need a psychiatrist, that all he had to do was call the Canadian Mental Health Association and get involved with their early psychosis program. There are many reports that encourage early intervention, which I agree. The earlier, the better. However, at the time, there was a 2-year waiting list before you were called into the program. Even though there are a number of reports that identify early psychosis intervention has better recovery, my son was not at a point where he was willing to accept that he had psychosis. And as a result, he did not call. And it took my husband and I 2 weeks, over 2 weeks, to encourage him to call and at least put his name in to the program. I felt at that time extremely angry. I remember going home and for days just being very angry that this individual was able to overrule the ER doctor, because I didn't know where to go from there. I knew my son. I knew that he was not willing to accept the fact that he had psychosis. And as a result, as I said, it took over 2 weeks to get him to contact the Canadian Mental Health Association. During this time, we took him to a psychologist who diagnosed him with severe depression, severe anxiety, and PTSD. My son, who is a very proud individual, decided he could take care of all of this himself. Unfortunately, things just continued to go downhill. And because we're not privy to any information, we don't know if he ever got a call back from the early psychosis program, nor do we know whether he got a call from the psychiatrist that he was referred to by the family doctor. And when we asked, he would say that he never got the call. Things just continued to decline from that point in time. He lost more insight into his illness. As a result, we are here today without a psychiatrist, without a diagnosis. He has been hospitalized 4 times. He's been on medication and he's been off medication. And this because he believes that he doesn't need it and that he's not sick. I can tell you that from the first year and moving forward, my family and I have been emotional wrecks. We got to a point that we didn't even recognize ourselves because of the worry, the feeling of being stuck and not being able to get help and not knowing who to turn to for help. We felt like our house was on fire. We called the fire department. They came and they stood outside watching us burn. And that's how I felt then. And that's how I continue to feel today. Unfortunately, the system that's in place right now does not allow patients who have a lack of insight to receive the medical care they need, nor does it allow parents to help their loved ones. I keep thinking back to the emergency doctor who had booked an appointment, but because there was another individual, a crisis worker, who came around and decided that their opinion was worthwhile. Maybe it was, maybe it wasn't. But I continue to ask, what if my son had gone to that appointment? Where would we be today? I will never know. I could only hope that based on the research that early intervention results provide better recovery, that would have been the case. In any event, it's not that we wanted the doctors to come and take us by the hand and take my son by the hand and do all the work, because we would have gladly done whatever was needed to be done. Unfortunately, there have been roadblock after roadblock. And it's very frustrating and tiring. As I said, we just don't know how to be able to help. You feel stuck. You're in a box with no way out.
Thank you. And our other mother, share your story, please.
Yes, sure. Before she became ill, our daughter was now 39, was a very driven, outgoing person. She was popular, many friends, male and female. She loved socializing and going to parties. She was always very talkative, problem in school, I recall. She loved skiing, she raced and then became an instructor. She got along well with her teammates. She liked to help others write resumes and find jobs. She worked part-time as a restaurant hostess while going to the Ontario College of Art and Design for her undergraduate degree. After graduating, she was driven to change her career course. She wanted to study for a master's degree in the UK. By then, she was 26, and she was diagnosed with adult ADHD, and it was revealed that she had an information retention issue. The psychologist at the time advised that she should wait before attempting a master's degree, saying that there was probably something more going on, but he couldn't talk to me about it without her consent. And she refused. So that was the beginning of the system failing our family. Shortly afterwards, she did start a 2-year master's degree in the UK in business. But it was in the second year we noticed changes that we didn't understand. Living 5,000 miles away, it was difficult to keep track, but we saw her often enough to become concerned. As time passed, she became more and more paranoid and suspicious about people monitoring her and her devices. I knew there was something wrong when she would tell me, I was supposed to be fired today. But fortunately, I wasn't. When I asked, how do you know that? She would answer. She wouldn't answer, in fact. Her jobs did not last, and friends seemed to be distancing themselves. She eventually returned home, but was clearly afraid of a conspiracy to ruin her life, orchestrated by her old boss. In the early stages, she would talk about it, claiming people were putting recording devices near where she was sitting. She was believing all her devices were bugged, and she even threw them at the wall in anger. We still have evidence. I would say she was not only angry, but upset and very afraid of what was happening to her. She knew there was something wrong. She also threw groceries at her father and then punched him when he, not understanding at all what was happening at the time, was angry at her for some strange behavior. She covered the ceiling light fixtures with sheets so that they were smoking, billows of smoke. And we caught it just in time before a fire occurred. She was no longer thinking rationally, and at first questioned what was happening to her. But she wasn't wanting to see a doctor. Instead, she wanted a lawyer to sue the people she thought responsible for the conspiracy. Over time, other delusions have come and gone. At least we think they've gone, but the persecutory delusion, as it is formally called, persists. For the first few months after she came home, she would hide in public and accuse anyone with a phone of taking pictures of her. She would regularly say he or she is one of them, meaning the conspiracy. A major regret I have is that we didn't understand she would stop talking about it. She eventually retreated into herself and refused to talk about her illness and distrusted everyone, including her parents and doctors. I asked a friend with a similar story if she could recommend a psychiatrist. She laughed, saying, "Good luck," but sent me the book, "I'm Not Sick, I Don't Need Help," by Dr. Xavier Amador. It was the best thing anyone did for me at that time. I've read it numerous times and learnt a lot. We managed through contacts to find a psychiatrist, and we had to lie to her to get her to see him. He prescribed medication, which she took for a short while. And I remember thinking, 3 months of this med and she'll be back to normal. Little did I know. It's now 5 years. She started running away and secretively left home for Europe on a few occasions, once taking my credit card. She believed she was running away from the conspiracy. Her first hospitalization was a year later, after her father tried to stop her running away. She punched him in the head, where he had recently had extensive cancer surgery. I recall the scarcity of care and the hoops we had to go through to get any care at all for our daughter, compared with the abundance of care offered to my husband for his cancer treatment, for which we're very grateful. With medication, our daughter becomes more like her old self again, and the delusions seem to fade into the background. But she has never stayed in treatment long enough to gain insight into her condition. Like many others, she may never. She does not believe she's ill, so why take medication that is, quite frankly, has very undesirable side effects? Where did my child go? I always thought she would come back from wherever she went and be as she used to be. But honestly, after 5 years, I'm beginning to lose faith in that.
Thank you. You all shared about the diagnosis or diagnoses and the years it took to get it, feeling helpless, unaware of what or where to go, unable to help your child. If a family whose child was just diagnosed today, what would be the expectation they should expect? What would you suggest they do as first steps?
Some good advice that was given to me was to keep copious notes. Make extensive notes about the behavior, the date, the time. And these items can help you later when you need to summarize things for the health professionals. Don't be afraid to speak to all your friends, coworkers, ask for suggestions. It doesn't help to try to resolve things all alone. The patient's not going to get better on their own, and the family needs to have some support as well. Speak up to the doctors. Make a point of writing the information, either handwritten or in an email, making sure that the nurse gets a copy, the doctor gets a copy. What are your concerns exactly? Those are some things that come to mind for me.
I have to agree with my friend here. One of the other suggestions is a self-care. Make sure that you take care of yourself, because if you don't take care of yourself, you most definitely will not be able to take care of your loved one.
And to our other mother.
Well, I would agree with the things that have been said. I mean, to keep in touch with the doctor, if you can develop that kind of relationship. For a long time, I was able to email my daughter's doctor, outpatient doctor, and he would write back immediately. The problem comes when your child starts to believe that they don't want the parent involved, and so they tell the doctor they don't want communication, and so he or she is not able to get back to you. But the important thing is you can still write to them, and they may not get back to you, but you can still inform them about what you're seeing in your child. And the book I mentioned, I'm Not Sick, I Don't Need Help, I think is a very good reference for someone new to all of this.
I think the beginning response that you just stated about keeping in touch, I think that in lies with, for all of you, the age of your children. Your children have become adults during this process. And so as an adult, you lose the ability to make decisions for them. So is there any direction, guidance, advice on how to become a decision maker for your child? Because even though they are older than 18, they are a child and they need your help. How do you get to that? And I'm sure there's no easy answer here.
Well, I became an official substitute decision maker very early on in the process. Her inpatient doctor approached me and asked me to do that because our daughter was refusing all kinds of treatment. And I did that. And so far, that has stayed in place. The substitute decision maker title is an official title. It's something designated within the Mental Health Care Act. Not all parents have been able to become a substitute decision maker, I understand. And your child, if they want, can make a change to anybody else they would like to have in that role, which is a little scary. And I always worry about that.
Yeah, that's a very good point, that the power of attorney can be changed every day if the person would like to do so. And that's one of the difficulties that we've had in our family, is we don't have a lot of cousins and uncles and so on. So I think that would be a tip for people beginning the journey, is to ensure that the extended family is involved to a certain extent. So if there's a dispute at home, you have the option, okay, out you go, and you can sleep on the Chesterfield at so-and-so's house. And as the trust builds up with the extended family, at least if it's not the immediate parents who are giving input to the healthcare treatment decisions, there might be some other next of kin that the patient could trust. It's quite a tricky point. And again, sharing information, having the information concise, and pushing that information in front of the doctor. They may not read it. They may think that they're required to check with the patient before they read it. But my understanding is that we can share what they call collateral information to the health professionals.
My journey is different in that we started in 2016. It is now 2023, and we don't have an official diagnosis. We don't have an official substitute decision maker. My understanding is that the doctors would have to go through the process identifying someone as an official substitute decision maker, and that has not happened.
So listening to all of you, again, similar commonalities. Becoming a substitute decision maker is not an easy journey. Action needs to happen to get this legislation changed so that family members can help their loved ones. You know, before we wrap up, I just want to reach out to each of you. If there's, you know, one thing that you want to mention, you can say it now, and then we can, you know, wrap this up for this evening and talk about this journey another day.
Yeah, I just wanted to point out how slowly it was for me to realize that my high expectations were no longer realistic. It's actually a bit of a grieving process. In our case, being designated as a gifted child in grade 2, you know, this is years of high expectations. And there's still my son in there, and you know, spending time, we see that come out when we're just talking over lunch or something. And again, it's all now because of the medicine being so effective in his particular case, that to a certain extent he's back now. Doesn't have an amazing career, but he's doing really well on the medicine. So that grieving process initially and just facing the unknown, I felt quite disoriented. And, you know, you have to sort of realize your expectations. It's a longer haul than we'd like to think at the start of it all.
You don't recognize yourself while you're going through that. You're basically looking at your family and it's falling apart. Or you feel like you feel like it's falling apart. It's all consuming. You don't think about anything else other than your loved one and how can you help them and what's going on. You don't want to see anyone anymore. You don't want to leave your own house. You don't want to have friends over or go to friends' homes because you're not sure what's going to happen either at the house if you're not there, or if someone comes over, what will happen? Will your loved one be having a psychotic break? You feel very traumatized. And for that reason, I say, absolutely practice self-care. It's a crisis that you, your family, and your loved one is going through. You go through all the trauma symptoms. You go through grieving. The life that you've planned is no longer, or it may not be the same as you had planned it. Your child is in there somewhere. They are in there. It comes out every once in a while, but it may not be what you had planned for their future. And as a result, it's very, very important to take care of yourself and make sure that you look at yourself as important, being important, and taking that time to provide that self-care.
Yeah, I I think it's very important to keep the hope going. I feel at times, I think I mentioned earlier, that mine's beginning to fade, but I have to keep trying to keep that hope alive, that things will get better, and that my daughter will be as close to as she used to be as possible. One thing I could say is that sadly, you tend to lose your friends, partly your own fault because you don't want to associate with them. You're reluctant to have dinner, have conversations, because it inevitably turns to children and grandchildren, and you can't participate in that discussion at the same level. And I find I avoid people who talk about their kids and their grandkids all the time because it's so different from my experience. We'll never get there now.
Ladies, thank you so much for sharing. We need to continue to share the journeys that you're on. We need to continue to communicate. This is an important issue that really needs addressing. There's a lot of hope, but those in crisis need to be able to access healthcare. Action needs to happen, and we need to get legislation changed. We encourage you to visit our website at reformmentalhealth.ca. Thank you for listening, and we will continue to share our journey.